Hi, this is George Sachs, and this is the Adult ADD Solution. Today we're going to talk about the shoulds and the problems with shoulding on yourself. I'll give you an example of what this means. I used to have a client who was a physician and would see patients every day. And if you've been to a doctor recently, you know how challenging it is for the doctors because they have to input everything into the computer right when they're seeing the patient. And this doctor felt overwhelmed by the amount of data he had to input into the computer, and it was affecting his relationship with the patients. So I simply said, well, is there a workaround, a different solution that you can use? For example, bringing a nurse into the room and he or she could input the data, or using medical transcription or some other service. And he said to me, no, I should be able to do it. Right there, I knew that we were going to have a problem because he couldn't get past the point. He couldn't get past the belief that he had to do this and that if he couldn't do it, it would somehow be detrimental to his self-esteem and to who he was as a doctor. So it's very important to understand your weaknesses with adult ADD and your strengths and to focus on your strengths. In this case, the doctor's weakness was gathering all the data and putting it into the computer. He was great with the patients, but he couldn't do both, and he wasn't willing to find a solution to solve the problem. So my recommendation for you is to figure out if you are shoulding on yourself, find a workaround or a new tool or technique to get the task done using your strengths and not your weaknesses. This is the Adult ADD Solution. I'm Dr. George Sachs, and stay tuned for the next lesson. Thank you.